Hi guys, welcome to this episode of Responding to Your Questions. This is a segment where I respond to questions or comments that have come through in the comment section from one of my videos. My name is Dr. Sylvia. I'm a consultant in general practice, and this question is around pregnancy with fibroids or getting pregnant with fibroids. So let me read it out to us. This person says, I have subserous fibroid measuring 6.5 times 3.9 centimeters in the right ovary at the upper region of the uterus. Can you suggest how or if I can get pregnant? Will subserous fibroid affect my baby growth? So fibroids, as we know, are benign growths in the womb. The key issue here is looking at the size and the type of the fibroid. Remember that none of the information that we're sharing here today can be used specifically to treat any one person. It's always important that you're speaking to your doctor and your specialist who knows your specific health circumstance, who has access to information about the way the fibroids are impacting your symptoms. But generally, as a guide, we're looking at a large fibroid because in terms of the size, centimeters, we would look at small fibroids as under 3 centimeters. Medium-sized fibroids would be sort of from 3 to 5 centimeters, and then larger fibroids above 5 centimeters. So this will sort of fall into a large fibroid that we're talking about in this instance, and they've described that this fibroid is sitting in the upper part of the womb around the ovary. The other information that we've been given is the type of the fibroid. Remember that there are different types in terms of where the fibroid is located. So the intramural is the fibroid that's within the muscle wall of the womb. The subserosal, which is this type that's being described here or discussed here, is the one that sits above the top layer of the womb, while the submucous is the one that sits underneath the inner lining of the womb, or the inner layer of the womb, where within the womb cavity where the baby would grow during pregnancy. You also have a pedunculated type of fibroid. So fibroids can come in different shapes and sizes, and that is why we don't just give general information to one person. It's important to look at the specific circumstance. So a lot of things will determine whether or not this fibroid would impact or affect pregnancy. Many fibroids do not affect pregnancy. So many women go ahead to have babies, have their families, not even realizing they have fibroids. In the instance of one that has this kind of size, the potential that it could affect fertility and pregnancy is present, yes, but I think you need a lot more information. What symptoms is it causing? Is it causing problems with bleeding or pelvic pain and so on that could also affect the whole process of trying to get pregnant before you even think about whether the fibroid is in such a place or size that it's pressing on the ovary or pressing on the fallopian tube, or in such a way that it is putting pressure on any other organs that might affect pregnancy. So the simple answer in this instance is that yes, there is a potential that it could affect pregnancy, but to what extent we don't know. There may be no effect depending on how the fibroid is located, and it's possible when she ovulates from the left side, from the left ovary, the pregnancy is able to come into the womb. The fibroid does not affect the inner part of the womb, and she can go ahead to carry the pregnancy. These are considerations that you would look into. I think the best thing would be to have a sit down with her doctor, look at what's been going on in terms of trying to get pregnant, what challenges she might have been having outside of just the position and size of the fibroid. I hope this helps. Let me know what you think in the comment section, and I'll see you again soon. Thanks for watching. Bye bye.